Hi friends, welcome to PharmaGrid. So today's video is a continuation of my previous video. We are going to discuss some clinical oriented patient case study type of questions. So starting with the first question. A 61-year-old woman is going on a cruise and is afraid that she will develop motion sickness during the trip. She is given a prescription for scopolamine patch. She has no other medical problems and has never had surgery. On the first day of the trip, the boat is rocking heavily and the patient is nauseous and she applies the patch. Instead of being sedated, she actually became very excited and agitated. What is the most likely explanation for these findings? Options are patient also drank 4 beers in addition to using the scopolamine patch. Patient did not follow proper medication directions. Underlying hepatic insufficiency. Underlying renal insufficiency. Underlying urinary tract abnormality. Correct answer is option B, that is patient did not follow proper medication directions. In contrast to atropine, scopolamine produces sedation, but at higher doses it can produce excitement instead. Scopolamine may produce euphoria and is susceptible to abuse. It turns out that this patient actually inadvertently applied 2 patches instead of 1 because of her fear of motion sickness. Furthermore, this is one important point, that is this scopolamine patch, that is this agent does not treat motion sickness, but it is a measure in order to prevent the motion sickness. Okay, so this is one important point to be noted, that is scopolamine agent is for the prevention of motion sickness, not for its treatment. Alcohol would likely produce sedative effects in this patient. This patient has no evidence of hepatic insufficiency or renal insufficiency given that she is otherwise healthy. There is no reason to suspect an underlying urinary tract abnormality in this patient also. Hence, we can choose the option as B. Next question. A 43-year-old man is stabbed in the chest and is brought to the emergency department for evaluation. Because of hemodynamic instability, he is brought to the operating room for thoracotomy. An adequate anesthesia history could not be obtained from the patient. No family member was present at the time of surgery. Upon induction of anesthesia with succinylcholine, the patient's heart rate increased to 150 beats per minute and experienced muscular rigidity. What is the most appropriate treatment for this patient? Options are dantrolene, rapid warming with blanket, sodium bicarbonate administered intravenously, succinylcholine intravenous drip at steady state, tubercularine intravenous bolus. Correct answer is option A, that is dantrolene. When halothane is used as an anesthetic, administration of succinylcholine has occasionally caused malignant hyperthermia with muscular rigidity, metabolic acidosis, tachycardia and hyperpyrexia in genetically susceptible people. This is treated by rapid cooling the patient and by administration of dantrolene. Dantrolene, the mechanism of action is by blocking the release of calcium from the sarcoplasmic reticulum of muscle cells, thereby reducing heat production and relaxing muscle tone. Okay, so this can be a case of malignant hyperthermia. The treatment option is dantrolene. Question number 48. A 79-year-old man undergoes a hip replacement procedure under general anesthesia and is unable to be weaned from the ventilator postoperatively. Review of the anesthesia records indicated that he received the following agents, which includes succinylcholine, diazepam, rocuronium and fentanyl. Fentanyl is an opioid. He spends the next 5 days on a ventilator in the intensive care unit. Which of the following is the most likely explanation for this situation? Options are diaphragm paralysis, hypokalemia, hyponatremia, hypocalcemia, underlying digitalis toxicity. Here the correct answer is option A, that is diaphragm paralysis. Administration of succinylcholine to a patient who is genetically deficient in plasma choline esterase or who has an atypical form of the enzyme can lead to prolonged apnea caused by paralysis of the diaphragm. The rapid release of potassium may also contribute to prolonging apnea in patients with electrolyte imbalances who receive this drug. Now let's see why the remaining options are wrong. Option B. Here in the option it is given as hypokalemia, but hyperkalemia is possible in patients who receive succinylcholine. Now option C. It is given as hyponatremia. This patient is likely to have normal serum sodium levels. Then option D. It is given as hypocalcemia, but this patient may have hypercalcemia, not hypocalcemia. Then option E means there is no evidence to suggest digitalis toxicity in this patient. Hence came the answer as option A, that is diaphragm paralysis. Next question. A 73-year-old man presents to his primary care physician complaining of a weak stream and nocturia 4 times at night. He is very sensitive to the medication side effects and is reluctant to take medications for this reason. Physical examination reveals a mildly enlarged prostate. Treatment of this condition may involve the use of which of the following agents to minimize side effects? Options are doxazosine, prazosin, tamsulosin, terazosin. Correct answer is option C, that is tamsulosin. Tamsulosin is a selective alpha-1 antagonist or selective alpha-1 blocker that is used to treat BPH or benign prostatic hyperplasia. This drug is clinically useful because it targets alpha-1 receptors found primarily in the urinary tract and prostate gland. Doxazosine and terazosin are non-selective alpha blockers that have to be dose titrated for efficacy and thus have a significant side effect profile. Prazosin is not used in the treatment of benign prostate hyperplasia. So the next question. A 68-year-old man presents to the emergency department with worsening chest pain. He has a history of congestive heart failure and currently takes digoxin. Physical examination reveals an acutely ill man who is tachypneic. Tachypneic means rapid breathing. His room air pulse oximetry is 90%. Pulmonary auscultation reveals bilateral wheezing. Neck examination reveals jugular venous distension. Which one of the following is the most appropriate treatment for this patient? Options are albuterol via nebulizer, dobutamine, epinephrine via nebulizer, norepinephrine, phenylephrine. Here the correct answer is option B, that is dobutamine. Dobutamine increases cardiac output without significantly increasing the heart rate, a complicating condition in heart failure. Because epinephrine can significantly increase the heart rate, it is not typically used for acute heart failure. Norepinephrine would worsen cardiac failure in this patient, hence not chosen. Phenylephrine would not serve as an inotropic agent, which is most needed in this patient. Hence, the answer came as option B, that is dobutamine. So we have completed today's question discussion series. Please like, share and subscribe. Thank you everyone for watching my video. Have a great day.